Our mission at Addenbrooke's Abroad is to inspire and enable our people to improve healthcare globally. We do this in a number of ways. The most important is to bring together dedicated, passionate healthcare workers across the globe to make lasting change. Engaging our committed practitioners in international volunteering produces a creative energy both in Cambridge and overseas to make real and lasting change. People like Mags Hamilton, volunteering in Myanmar, just one of the many volunteers who've taken up the opportunities that Addenbrooke's Abroad creates to work alongside healthcare workers in other countries in ways that enable everyone involved to learn.
I have been here in Yangon for 7 months as the first long-term volunteer with Addenbrooke's Abroad and the Cambridge Yangon Trauma Intervention Partnership. Living in Myanmar for the past 7 months has been a little challenging. I live in an apartment beside the railway line and I have to pump water every day, and I have a selection of street dogs that live outside. All the patients in Myanmar are looked after by their family. They have 2 or 3 family members looking after them. As a result, I've ended up working with the nurses in slightly different ways. I've built relationships with them and participate in their continuing nurse education sessions. The reason we are developing local faculty is that we are hoping that our courses will eventually become sustainable and will be able to be run within Yangon with minimal input from us.
They include the teaching sessions and the small group discussions, or when we divide ourselves into some small groups and discuss with the group members. We practice about the POP application, and we practice about the physician and flag procedures and wound deployment. Yes, is very useful for us.
This is the 3rd time that the pathology team has come out to Yangon General Hospital. I've been fortunate enough to come out twice. So the best thing about being here this time has been just walking around the laboratory and seeing concrete evidence of processes being put in place that we discussed with the staff last time I was here.
It's hugely important to us that we make effective use of the money contributed by all our donors and the time and expertise that's given freely by our volunteers. Often, the smallest and least expensive changes can have a major impact. For example, infections are a major cause of sickness and mortality among newborn babies in countries like El Salvador and Botswana. At Addenbrooke's, we've reduced hospital-acquired infections by systematically applying simple hygiene measures in and around every clinical area. At Princess Marina Hospital, introducing the same standards of strict hand washing and hygienic food preparation policies is having a significant effect on the rates of infection.
We admit premature babies and sick neonates. We admit the neonates from the entire country because we are the 2nd referral hospital in our country.
My role was really kind of to take the lead from Mary King and Dr. Sue Broster from their visit previously to Botswana, and just to look at what the Botswana nurses would actually gain from working and having 2 weeks with us here at CUH. It's been great. We spent the first week looking at developing, just getting them to observe our clinical area and our NICU. And not necessarily the equipment that we have, but more about the interactions they have with our parents and looking at things that they can actually develop and take home with them.
The first time I came here, when I got in, I was like, wow, this is a state-of-the-art hospital, but looking beyond everything else, beyond the machines and everything, the equipment that we are having. The service is awesome. It's far much better than we are having back home, and I think it's something that we can take back with.
The benefits are not one-sided. CUH staff volunteering in other cultures, finding ways to apply their technical expertise to overcome real challenges in the healthcare environment has a meaningful impact on their leadership, team working and innovation skills. Placements overseas help to build a degree of resilience amongst our people that is a considerable benefit to us here in Cambridge.
We did a neonatal life support mandatory training session on Thursday, and it was great to see actual working and discussion between staff about, oh, how do you do this and how do you do that, and that questioning from both sides, and I think that's really crucial.
It's really helped strengthen our team locally. We've learnt from the link, we've learnt how to do more with less, which is a real help to the NHS when resources are tight, and we've seen a real growing together of the team in terms of their ability to solve problems and in working relationships with those that have been involved. So this has been a fantastic experience all around. It's been fantastic for us, for our medical students that have been there, and I think we're really starting to deliver something which is going to make a real difference to the burden of blindness in Botswana.
This is my first time to visit Myanmar, and in this visit I intend to examine the procedures and processes in the blood transfusion laboratories in Yangon General Hospital. I also will look at the practices in the blood service and how these support blood transfusion in Yangon General Hospital as well. Since I have arrived in Myanmar, I have been looked after by a number of people, and I don't think I've ever had such an attentive and enthusiastic audience ever in all my 40 years.
In addition to the gains in professional development, volunteers find that being immersed in a completely new environment can provide a rich cultural experience.
For me, it's actually an immersion in a different culture. I take the opportunity to walk to lots of places, and I get to see, and you experience the smells of the street market, the noise. So if you get out, step outside of your air-conditioned car, and you can go off the streets and you can walk around the city in great safety and just see so many things.
We've seen marvelous changes. At the moment, our government bought extra 4 cameras, so we've got 5 screening centers in the whole country. Even though they're sparsely distributed, but at least there's something. And it is all because of Addenbrooke's Abroad.
I think being appreciative of actually some of the cases that we saw where the outcomes were really quite sad, that those babies would have actually survived over here, I think that was something that really had quite an impact on me. I think that's certainly something that I will remember for a long time. But how easily resolvable some of their problems are, just with the right guidance and support, and not always about resources really, but just having permissions, I think that was really powerful.
Addenbrooke's Abroad is also about supporting development of our future healthcare workforce. By bringing our teaching methods and expertise into formal education for medical and nursing students, we are laying the foundations for robust, sustainable health development and self-sufficiency.
We need to train the people. For that training, we need a skill training center. That's why in this project, we focus in 3 areas. One is trauma. Another one is pathology, and we need support laboratory and pathology to take care of the trauma, and also training and skill training. We plan to develop the skill training center in the University of Medicine 1, and then trauma service and laboratory service in Yangon General Hospital. Now we are trying to develop the local faculty. In future, Myanmar orthopedic surgeons, they can run the course themselves for the whole country.
I have some experience and I'm involved with the Cambridge because last 1 or 2 years when I was in the university, I sent my students to attend the Cambridge course, and I had a chance to come and see. What I saw with the Cambridge course in the SOT and the ADAP is that there is a different teaching method from us, because usually here we have some form of teaching from the teachers or the lecturer, and there is less interactive action from the students.
Quite innovatively, they all have smartphones, and they were filming some of the things we were doing, so they had a reference. And one of my key considerations was the sustainability of the project. And some of the mannequins are very expensive, but if you think about what they're made of, they're sort of blocks of rubber, foam and pads. And so it was looking at where we could source cheap local equivalents. And so, for example, I took some people down to the market, and the upholstery stall who was selling different bits of foam. We could buy bits of foam that we could cut up to use for suture training instead of buying that foam.
The rector of the University of Medicine 1, Professor Zaiwei Zhou, has been very supportive of our project right from the beginning. And I have had meetings right from my first day here with him. The University of Medicine 1 has very kindly provided my apartment. When we had a meeting at the end of our last visit, our last teaching visit, we were able to talk quite frankly.
Without Addenbrooke's Abroad, we wouldn't have achieved anywhere that we are now.
Here in Cambridge, we're focused on excellence in healthcare, education and research, giving outstanding clinical care to our patients. We share this goal with our partners here on the 140-acre Cambridge Biomedical Campus, carrying out cutting-edge medical research with a global impact. Addenbrooke's Abroad takes this ambition to a much wider community. Many healthcare problems are truly global and can only be tackled by building the knowledge and skills of healthcare professionals locally, right where they are needed. Addenbrooke's Abroad connects people. It enables us to take some of our people and their expertise to health systems overseas in ways that will make permanent and sustainable improvements to people's health and survival, both overseas and in the UK. Our programme goals are simple: to expand our reach to support more healthcare workers, to maximise opportunities for reciprocal learning, development and research, and to demonstrate our impact on and through people. Addenbrooke's Abroad does not receive any funding from the NHS and relies entirely on donor support. Everything that we do depends on our volunteers, because giving up their time to get involved in this fantastic work ensures that the money our donors give is spent efficiently. Through the generosity of so many people, Addenbrooke's Abroad is able to deliver sustained and lasting collaborations, delivering real improvements in global healthcare.